Hi, everybody. Welcome to this week's Sidebar conversation. I am actually in my office today. You can see that. So, I actually made it to campus. But since I'm in my office, I wanted to show you from last week. I was talking about a derm reference of mine that I really, really like. So, I did post the link for it, but just so you can kind of see it, dermatology DDX, a differential diagnosis. And like I said, it's like just a paint chip color wheel of all of these dermatological conditions. And it's really, really nice. And so just to give an example, with a picture that's not too ungodly gross here. So here's a type of dermatitis. So there's lots of different pictures of it. And then you just flip to the back of the pictures, and I know you can't really see it that well, but that goes a description, which is really helpful for when you're writing in your notes, so you know how to describe the lesions that you're seeing, and also treatment and stuff is on the back. So just so you can kind of see what it looks like in person. It's nice to it fits right in your clinical bag. You can take it with you. I use this all the time in my practice. I'll take it out, look at the pictures, put it next to the person's skin. Is this what I'm seeing? So this I really, really like. One of my favorites. Certainly is not required of you to buy it, but if you're looking for a good derm reference for clinical, definitely recommend it. So this week we talked about ENT complaints. Not too many chronic things going along, with that. Wasn't too heavy of a week in regards to content. But just wanted to go over in terms, especially with eye complaints, when you're going into a primary care setting, family practice setting, you know, I have a very low threshold for what I refer out when it comes out to eye complaints. Like, yes, I will manage pink eye, and a simple thing like that, or like a corneal abrasion. But even then, especially like with a corneal abrasion, which I know is acute, I always say, go, here's some antibiotic ointment, whatever the treatment is. You need to follow up with your eye doctor, in a day or two, especially if symptoms get worse. So eye complaints have a high liability factor because if you mess something up, if you miss something, you could be, messing with somebody's vision. They could have permanent visual deficits, which could absolutely be devastating. So, I'll have coworkers ask, "Oh, I think I have pink eye. Can you, just send me in some eye drops?" And it's like, unless I'm actually seeing you, looking in your eye, I'm not going to do it because, if I miss something, if it's not pink eye and it turns out to be a corneal abrasion, but I didn't have my fluorescein stain to see, and you end up with visual deficits, that's not going to be on my hands. So, common complaints like dry eye, you can always say, try some saline drops or, whatever for a few days. But always, when it comes to the eye, you always want to say to the patient, and of course in your documentation, that if there is no improvement in 24 hours, 48 hours, whatever it is, depending on the severity of the issue, follow up with your eye doctor. If you ever think that there's a foreign body in somebody's eye, there's, a piece of metal or wood or something, follow up with the eye doctor because they are the specialists and we do not want to mess with anybody's vision. So that's my little soapbox for this sidebar. Hope you are all doing well. Haven't heard from anybody, so when I don't hear from people, I assume things are going well. So please, as always, reach out if you have any questions. You do have a test coming up next week, so I'll be sending out the blueprint and the test review and things like that. So make sure you review that, go over your notes, and once again, I'm always here if you need anything, and I hope you have a great week.